patients before they even knew that the COVID-19 existed. Numbers that you are going to see are going to skyrocket because there are two reasons. The first one is thousands of doctors took care of millions of patients before they even knew that the COVID-19 existed. They took care of them without PPE at all. So all those doctors who didn't have PPE, that's nurses, that is medical office assistants, those people are going to be getting tested. As they get tested, those tests are going to be positive. When those tests are positive, that is going to spark a hospital shortage of doctors, nurses, and medical office assistants, let alone the shortage of the PPE. That is when the rubber's going to hit the road. We can no longer talk about it. We have to be about it because the infectivity of the coronavirus is R naught. That's what we use to look at the infectivity. It's 2 to 3, meaning every one person that's infected can actually infect 3 people. Once we have that start to mushroom, people are going to panic. Once people panic and their increased levels of cortisol in their bodies go through the roof, that is a steroid. The steroid will decrease your immune system, which makes you more apt to get the disease. We have to do what we need to do by social distancing. The PPE shortage will go throughout the world because we have to ramp up all of the manufacturing. But we have to also remember we will not have doctors, nurses, and medical office assistants because we had things like Mardi Gras. We had things like these big festivals, and nobody knew. That's the problem of the federal government. Nobody knew because nobody took it seriously. Now we're behind the 8 ball, and we have to catch up. We cannot talk about it. We have to be about it. Social distancing. I see people playing basketball on the streets of New Orleans, basketball in LA. We cannot do this. We are behind the curve. We must flatten this. Ask the people of Philadelphia of 1918. When they had their big parade, thousands of people died in 6 weeks. St. Louis distanced, and they were 900 miles away. St. Louis distanced, and they had several hundred people die. It's very important.
Yeah. Indeed, Dr. Redline, I want to note that Apple, Tim Cook of Apple has said that Apple is now sourcing and donating millions of masks for health professionals in the U.S. and Europe. It is a sad day when you can sort of trust a CEO from a big old corporation when they say they're doing it more than the federal government when they say millions will be available. That's just my note. That's not for any of the doctors. Let me go to Dr. Redliner. Donald Trump is not a doctor. He has no background in medicine or in science. I'm not sure he believes in science. He looked directly into an eclipse, thought that was a good idea. But he tweeted out about these 2 drugs, claiming that they have a chance to be a game changer on this. We'll put that up. I'm not going to read it. He also said that the FDA has done work on trying to get a number of therapeutics. Actually, we're not going to play that. But they're claiming that these drugs, as you can see them there, are potentially an answer to this. The FDA seems to dispute that. Can you just sort out what's true here, sir?
Sure, Joe. This is a really important issue, starting with what you first said, which is, we kind of don't want to hear from Donald Trump about anything to do with the medical treatment or prevention or whatever. We want that to come out of the mouths of people who are actually experienced and know what they're doing. As far as chloroquine and other anti-malarial drugs, drugs used to treat people with malaria, there was some question of whether it might work. But we cannot be distributing medications to the public without making sure that they're safe and they're effective. That's it. That's the only reason that we would not use something that might work. And by the way, there are many other drugs that are being tested right now, and we may see something promising soon, which would be fantastic, obviously. But we do not need to be told that a medicine that has not been tested for this is somehow the magic answer. It just isn't.